Namaskar, my dear students. Today in the dental materials section, we will be discussing dental cements. Many students have requested for this topic. As this topic is long, so we will be discussing all the classifications followed by zinc phosphate and zinc polycarboxylate cement in detail. So let's begin. So first of all, what is a dental cement? You know what is a cement? Cement is a binder which fixes or adheres to material. Similarly, in dentistry also, the dental cement is a binding element or agency used as a substance to make the objects adhere to each other or something serving to firmly unite. Okay, according to Enosevice, what is a cement? It is a substance that hardens to act as a base, a liner, a filling material, or an adhesive to bind the devices and prostheses to the tooth structure or to each other. Okay, so these are basically the uses of the cements. It can be used as a base, liner, filling material, or an adhesive. So let us discuss them in detail. Coming to the classification of cements, there are various bases on which the dental cements can be classified. First is based on the application or uses in dentistry. Second is based on the ingredients or the composition. Third is based on the setting reaction. And fourth is the ISO standards covering the cements. So let us discuss them one by one. The first classification is based on the application or the uses. In this, first is type 1 or the luting agents. What do you mean by a luting agent? Any indirect restoration, the restoration which is prepared in the lab, inlay, onlay or a crown, is attached to the prepared tooth with the help of the luting agent. Okay, this can be further of two types depending on the grain size. Type 1 fine grain for cementation and luting. Type 2 medium grain for bases and the orthodontic purpose. Okay, now coming to the type 2 restorative applications. What do you mean by restorative material? Restorative material are used for filling the tooth cavities or treating the dental caries. Okay, now this can further be intermediate or temporary restorative material, or it can be the permanent restorative material depending on the duration we are using it. Type 3 liners and bases. What do you mean by liner and bases? They both are used between the direct restorative material and the tooth for pulpal protection. Now, what is the difference? A dental liner is placed in a thin layer, okay, over the exposed dentine, while a dental base, it is placed on the floor of the cavity and it is relatively thick layer. It protects the pulp by providing the thermal insulation, okay, due to any temperature changes, and it also absorbs the occlusal forces. Now, when we are talking about the applications, many questions are asked which cement you will use for a particular use. Okay, so let us just know this. First, if we are going for a temporary cementation, that means cementation for a short duration. Let it be for a temporary crown. So we will use the cements like zinc oxide eugenol or non-eugenol zinc oxide. Second is for the final cementation, like the porcelain fused to crown, metal crown or a all metal crown. Then we will use the cements like zinc phosphate, zinc polycarboxylate, glass ionomer and the resin cements. Resin cements we mainly use for the all ceramic crowns. Okay, third is for the temporary restoration. When the restorative material for a short duration has to be filled, we can fill it with zinc oxide eugenol or reinforced zinc oxide eugenol. It is zinc oxide eugenol only, but a modification with increased strength. Then permanent restoration. We can use glass ionomer, modified glass ionomer cement or the compomers. Then bases, as we just discussed, for the thermal insulation placed on the floor, we can use zinc phosphate, zinc polycarboxylate, glass ionomer, zinc oxide eugenol or calcium hydroxide. Then comes the liners. They also solve the purpose of the pulpal protection applied in thin layer. Calcium hydroxide in a suspension can be used as a liner. Pulp therapy, when we want that reparative dentine should be formed. Okay, secondary dentine should be formed. For the pulp capping, direct pulp capping and the indirect pulp capping, we use calcium hydroxide. Then obtundant effect, it gives a pain relief effect. There we go for zinc oxide eugenol. And last is the root canal sealer. When we are done with the root canal treatment and we have to seal the root canal, we can use zinc oxide eugenol, zinc polycarboxylate, or the resin based sealers are also available now. Now these are very important as they are commonly asked in the viva and in the multiple choice questions also. The second classification of dental cements is based on the ingredients or the composition. Based on composition, they can be the water-based cements, in this glass ionomer cements, zinc phosphate and zinc polycarboxylate. Second are the resin-based cements. In this, the composite and the adhesive resins as well as the compomers. Third are the oil-based cements. In this, zinc oxide eugenol and the non-eugenol zinc oxide cement. The next classification of dental cements is based on the setting reaction. This is a very common classification system which is asked. So three types are there. First is the acid-base reaction. In this, the cements, they are supplied in liquid and powder form, in which the liquid acts as the acid and powder as the base. So when the powder and liquid are mixed, the acid-base reaction takes place to form a solid mass. Okay, examples are zinc phosphate, zinc oxide eugenol, and the glass ionomer cement. Second is the polymerization reaction. These type of cements, they set by the polymerization mechanism. Okay, now this polymerization can be activated either chemically, some chemical initiator is present in the composition, or by some light. Okay, some photo initiators are present in this. Examples are the resin cements. Third are the dual cure and the tri-cure cements. From the name itself, dual cure means it can be set by two mechanisms. Tri-cure means it can be hardened by three mechanisms. Okay, so in the dual cure cements, they set by the acid base and any one of the polymerization mechanism, let it be light activated or the chemically activated. Tri-cure, they use all the three mechanisms of settings. Okay, so this is just the according to the method of the curing. Okay, examples are the resin modified GIC and the compomers. Next are the ISO standards covering the cements. The ISO 99171-2003, these are the water-based cements part 1. They are available as powder liquid system, they are acid-based systems. Then ISO 99172-1998 water-based cements part 2. They are the light activated cements. Third are the ISO 3107-2004. These are zinc oxide or eugenol and zinc oxide non-eugenol cements. Last are the ISO 4049-2000. These are the polymer based cements like the resins used for filling, restorative and the luting. If we just go back to the history and see the timeline of the dental cements, silicates were the first cements to come. Okay, they were invented by Fletcher in 1873. Then zinc oxide in 1873, zinc oxide and the clove oil by Chisholm. Okay, followed by zinc phosphate in 1879 by Dr. Pierce. Then calcium hydroxide came in 1930. Okay, the calcium hydroxide paste, it was invented by Hermann. Okay, then this was followed by polycarboxylate cement in 1968 by Dennis Smith. Then in 1971, glass ionomer cements, they came into the picture by Wilson and Kent. Okay, now amongst this, glass ionomer cement are commonly asked by the examiner that who invented and when it was invented. Now let us discuss the ideal properties of the dental cements. First is its low viscosity and the film thickness. It is a very important property, especially for the luting cements. You know, the film thickness should be less, flow should be good, so that it improves the seating of the restoration, and greater flow will lead to more wetting of the tooth as well as the restoration surface. Okay, the film thickness should not be more than 40 micron. Second is its long working time with rapid set at oral temperature. What does it mean? That we should have enough working time. We are mixing the cement and then we are loading onto the ground. But once seated, it should have a rapid set. Okay, so that no contamination is there. Third is the low solubility. The solubility in the oral fluids should be minimal. Okay, otherwise what will happen? There will be marginal leakage and it will lead to secondary caries. Then high compressive and tensile strength. Mechanical properties are very important for a cement, whether it is a base or it is a luting agent. Then comes high proportional limit. The stiffness. It should have high stiffness, especially under the ceramic crowns. You know, it should be able to withstand the masticatory loads. Then adhesion to the tooth structure and the restorative material. This will give the retention to the indirect restoration. It will not come out. Okay, it will properly fix the tooth with the restorative material. Then anti-cariogenic properties. It should have fluoride release properties so that it prevents the caries, further caries. Biological property. In this we mean to say first the pH of the cement. It should not be much acidic. The pulpal response should be mild. Now let us discuss one of the oldest luting cement, that is zinc phosphate, in detail. Zinc phosphate, as I just told you that it is one of the oldest of the luting cement. It has the longest clinical track record and it also serves as a standard with which the newer systems can be compared. Okay, zinc phosphate cement was introduced by Dr. Pierce in 1879. The zinc phosphate cement is available as one, powder in the liquid system, and second, capsules of the pre-proportion powder in the liquid. Next, let us discuss the composition of the zinc phosphate cement. As we said that it is available in the powder in the liquid form. The powder mainly contains the zinc oxide, which is 90.2%. It is the principal constituent. Second is the magnesium oxide, 8.2%, which helps in fusing or the sintering. Then silica, it is the filler, 1.4%. Other oxides like the bismuth trioxide, calcium oxide, barium oxide, they improve the smoothness of the mix. Okay, so for remembering the composition, the name itself, zinc phosphate. So zinc oxide in the powder and phosphate, phosphoric acid in the liquid. So the main constituent of the liquid is phosphoric acid, that is present in 38.2%. It only reacts with zinc oxide. Okay, second is the water, 36%. That is why the zinc phosphate cement, it comes under the category of water-based cement. Okay, then aluminium phosphate or sometimes the zinc phosphate is present, 16.2%. It buffers to reduce the rate of the reaction. Okay, then aluminium ions 2.5%, zinc 7.1%. They also helps in the sintering, the fusing and forming the mass. Setting reaction of the zinc phosphate cement. When the powder contains zinc oxide, it is mixed with the liquid phosphoric acid. The phosphoric acid attacks the surface of the particles and it releases the zinc ions. It forms zinc phosphate. Then the aluminium, which is present in the liquid, is essential for the cement formation. The aluminium, it complexes with the zinc phosphate and the phosphoric acid and also the zinc ions to form zinc aluminophosphate gel. This reaction is exothermic. If we see the picture, the set cement has a core structure consisting of the unreacted zinc oxide particles embedded in the matrix of zinc aluminophosphate. Classification of the zinc phosphate cement, ADA, it classifies the cement into two types. Type 1, fine grained for luting. Its film thickness should be 25 micron or less. Type 2, medium grain for luting and filling. Okay, but the film thickness should not be more than 40 micrometer. Manipulation of the zinc phosphate cement, it is one of the exercise which is done during the dental materials exam. Okay, so the questions related to it are asked during the manipulation. So for this, first of all, a cool mixing glass slab should be used. Now, why cool? This will prolong the working and the setting time, and it also permits the operator to incorporate maximum amount of powder. Okay, for this, frozen glass slab technique is also used. What is that? In that, the glass slab, it is cooled in the refrigerator at 6 degrees C or freezer at 10 degree minus 10 degrees Celsius. Okay, the advantage of frozen glass slab is that it increases the working time of the mix and it shortens the setting time of the mix after placement into the mouth. It is mainly indicated for cementation of long span bridges. Okay, this frozen glass slab is often asked in the viva. Okay, second is the stainless steel spatula is used for mixing. Powder liquid ratio is 1.4 gram is to 0.5 ml. Then the liquid should not be dispensed onto the slab until the mixing is to be initiated. Why? Because the water, it will be lost to the air by evaporation. Okay, then the powder is divided into several portions. The mixing is initiated by the addition of small amount of powder. Then the small quantities are incorporated initially with the brisk spatulation. A considerable area of the mixing slab should be used. Why? Because it is an exothermic reaction. Okay, so we want to mix in the larger area. Then each increment is mixed for 15 to 20 seconds before adding another increment. The total mixing, it completes in around 1 minute to 1.5 minutes. The maximum amount of powder should be incorporated. Why? Because it will ensure minimum solubility and maximum strength. Okay, then the crown is loaded or filled with a cement. Okay, it should be half loaded and then it is seated and placed in the patient's mouth. It is allowed to sit. Setting time of the zinc phosphate cement. According to EDA specification number 96, the setting time may vary between 2.5 to 8 minutes. Factors controlling the setting time. A very common question which is asked during the viva. First, the manufacturing process. First is the sintering temperature. You know, when the granules, they are sintered and the powder is prepared. That is the sintering temperature. The higher the temperature, the more slowly the cement sets. So the setting time will increase. Second is the particle size. Finer the particles, more quickly they will mix at a greater surface area. They will be exposed to the liquid. So it will fasten the reaction, the setting time will decrease. Then water content of the liquid. If there is more water, excess water will accelerate the reaction and the setting time will decrease. The buffering agents, if they are added, they slow down the reaction so the setting time will increase. Second, the factors which are under control of the operator. These are more important. Okay, first is the temperature. Higher the temperature, it accelerates the reaction so the setting time will decrease. So that is why we cool the glass slab. Second is the powder liquid ratio. More the liquid, slower the reaction, but this is not recommended as it affects the strength of the cement. Then rate of addition of the powder to the liquid. The reaction is slower if the powder is incorporated slowly, so the setting time will be increased. Mixing time, the longer the mixing time, okay, the slower will be the rate of the reaction, so the setting time will increase. Properties of the zinc phosphate cement. First are the mechanical properties. First is the compressive strength. The fully set cement, it has very high, relatively high compressive strength of the range 104 to 119 megapascals, and it gains 70% of its maximum strength in the first 30 minutes. But the ultimate maximum strength is attained at the end of 24 hours. Okay, mainly the powder liquid ratio should not be altered, because more the powder, greater the strength it will achieve. Second is the tensile strength, which is the cement is weaker in tension. It is 5.5 megapascals, which makes it brittle. Third is the modulus of elasticity, which is high, 13.7. It makes the cement stiff and also resistant to the elastic deformation. Okay, next is the solubility. The zinc phosphate cement, it shows low solubility of 0.06% weight, though it shows disintegration in the oral cavity, so the marginal adaptation of the crown should be good. Next are the thermal properties. It shows good thermal insulation, that is why successfully it is used as bases, and it is also effective in reducing the galvanic effects. Adhesion is micromechanical. That means it depends on the mechanical interlocking of the surface roughness of the tooth as well as the roughness of the restoration. Biological properties: the cement is highly acidic. At the time of mixing, the pH is 2. Then after 24 hours, the pH is increased to 5.5, which is still in the acidic range. Then comes the pulpal response. It is moderate. Optical properties: the cement is opaque. Applications or the uses of the zinc phosphate cement. First is luting of the indirect restorations like the inlays, onlays, then all metal crowns, porcelain fused to metal crowns. Second, it is used as a high strength base. Below the amalgam restoration it is used. Third, temporary restorative material also, the zinc phosphate cement is used. It is also used for luting of the orthodontic bands and the brackets. Advantages of the zinc phosphate cement. First, it has a long track record, as we just discussed in the beginning. It has good reliability. Second, good compressive strength. That is why it is used as a base below the amalgam restorations. Then disadvantages. First, there is no chemical adhesion. It is all micromechanical, so it depends on the roughness of the restoration and the tooth surface. So the retention is compromised. Second, no anti-carcinogenic property, no fluoride release. Third, acidic nature, which causes the pulp irritation. Last is poor aesthetics. The aesthetics are not good, so that is why it cannot be used with the all ceramic crowns and the veneers. Now we will discuss about the second cement, that is zinc polycarboxylate cement, in detail. Zinc polycarboxylate cement. You know, the Canadian biochemist Smith, he developed the zinc polycarboxylate cement in 1968. What he did, he substituted the phosphoric acid of zinc phosphate with polyacrylic acid, okay, and formed the polycarboxylate cement. This was the first cement system that developed an adhesive bond to the tooth structure. The zinc phosphate is mechanically bonded, and this will form the adhesive bond. Okay, now this cement is available as powder liquid system in the bottles. Then water settable cements. What do you mean by water settable cement? In this, the polyacid, it is freeze dried and it is added to the cement powder itself, and then the water is used as the liquid. Then it is also available in the pre-capsulated powder liquid system. Composition of the zinc polycarboxylate cement. It is in the powder. It has zinc oxide. You know, the constituents of the powder is almost the same of the zinc phosphate. So it contains zinc oxide, which is the basic ingredient, magnesium oxide, which is the principal modifier, and it helps in the sintering, the formation of the set cement. Then oxides of the bismuth and aluminium, They are added in small amounts. Stannous fluoride, this is an addition. It imparts the anti-carcinogenic properties also. It increases the strength and it also helps in modifying the setting time. Second is the liquid. Now the liquid is different from the zinc phosphate. Instead of phosphoric acid, it contains the aqueous solution of polyacrylic acid. Okay, or the copolymer of the acrylic acid. Okay, with other carboxylic acids, that is the itaconic acid, malic acid, and the tricarboxylic acid. Setting reaction of the zinc polycarboxylate cement. In this, the powder and the liquid, the powder zinc oxide and the liquid polyacrylic acid, they are mixed. The surface of the powder particles, they are attacked by the acid. Then they release the zinc, magnesium and the tin ions. These ions, they bind to the polymer chains, okay, via the carboxylic groups, and they form the zinc polyacrylate. Okay, now it forms the amorphous gel matrix of the zinc polyacrylate, in which the unreacted powder particles of the zinc oxide, they are dispersed. Adhesion with the tooth. Now this was the first cement to be chemically adhered to the tooth. Okay, now what happens, how it bonds chemically with the tooth structure? The polyacrylic acid, it reacts with the calcium ions on the surface of the enamel or the dentine via the carboxylic groups. Now this is one of the MCQs which is asked. Via the carboxylic groups, and thereby they adhere chemically to the tooth structure. The bond strength of the cement to the enamel is 3.4 to 13 megapascals, and to the dentine it is 2.07 megapascals. Manipulation of the zinc polycarboxylate cement. Now in the dental materials practical exam, you may be asked to mix the cement and show to the examiner. Okay, now the recommended powder liquid ratio for this is 1.5:1. A glass slab or paper pad is used to mix the cement. Okay, the paper pad should be such that it should not absorb the liquid. Glass slab is preferred because it can be cooled and we can go for a longer working time. Okay, then the liquid is dispensed immediately just before mixing. This will prevent the evaporation of water and subsequent thickening of the liquid. Okay, the mixing time is 30 to 60 seconds. The powder should be rapidly incorporated into the liquid in large quantities. Okay, the consistency of the mix should be creamy and it should appear glossy. Why glossy? So that it indicates that sufficient number of carboxylic acid groups is present on the surface that are important for the bonding with the tooth structure. Okay, if it is a dull looking mixture, it should be discarded. Okay, now working time is around 2.5 minutes. The setting time is 7 to 9 minutes. Before application, the conditioning of the tooth is important. It should be conditioned with 10% polyacrylic acid followed by rinsing with water, or 1 to 3% hydrogen peroxide. Then the surface should be dry and isolated. Properties of the zinc polycarboxylate cement. First, the compressive strength. The strength is inferior to the zinc phosphate cement and it is around 55 to 67 megapascals. Then the diametral tensile strength. It is slightly higher than the zinc phosphate cement. It is around 3.6 to 6.3 megapascals. Solubility. Solubility is slightly more than the zinc phosphate, okay, which is 0.6% weight. So the marginal dissolution, at the margins, the dissolution of the cement is more when we are using it for cementation purpose. Then biocompatibility, the it is pulpal response is mild. The pH of the liquid is 1 to 1.7, but it increases the pH of the freshly mixed cement when it is mixed with the powder. The pH goes to 3 to 4. And after 24 hours, the pH is 5 to 6. Okay, now how this is happening? The liquid, it is rapidly neutralized by the powder. That is why the pH is increasing. And second, the pulpal response is mild because the large size of the polyacrylic acid molecule, it limits its penetration into the dentinal tubules. Okay, as compared to the phosphoric acid which was present in the zinc phosphate. Okay, now optical properties, it is opaque in nature due to the unreacted zinc oxide particles. Anti-karyogenic property is present but it is very limited. Thermal properties, they are good thermal insulators. Applications or the uses of the zinc polycarboxylate cement. First, it is used for luting of the permanent restorations. The metal inlays, onlays, all metal crowns, then porcelain fused to metal crowns. Second, it is used as a high strength basis. Third, it is used for the cementation of the orthodontic bands. Advantages, if we talk about of the zinc polycarboxylate cement, it is less irritating to the pulp when compared to the zinc phosphate cement. Second, it chemically bonds with the tooth. Okay, disadvantages, the fluoride release is limited as compared to the glass ionomer cement. Second, some better options are available now, so these cements have become less popular. That's all for this topic, my dear students. Please like and share the video. You can give your topics in the comment section. Subscribe the channel if you are still new. Wish you success today and always.